For our project, we look at maternal health and infant mortality in developing regions. Ignaz Semmelweis, a German-Hungarian physician in the 1800s, provides one of the earliest examples of efforts to reduce maternal mortality. After instructing doctors to wash their hands before delivering babies, maternal and infant mortality rates plummeted at Semmelweis's hospital. Though infant mortality rates have steadily decreased over time and maternal health has steadily increased over time, there are still disparities between regions. Africa in particular remains well above the world average for infant mortality rates. The United Nations addressed both maternal and infant health in their Millennium Development Goals. The World Health Organization monitored the success of these goals and found that between 1990 and 2015, maternal mortality worldwide dropped by about 44%.
Between 2016 and 2030, the UN is aiming to reduce the global maternal mortality ratio to less than 70 per 100,000 live births. The World Health Organization states that all women need access to antenatal care in pregnancy, skilled care during childbirth, and care and support in the weeks after childbirth. It is particularly important that all births are attended by skilled health professionals. Promoting sex education, family planning, and maternal and infant health education to local women are central tactics to lowering maternal and infant mortality. Training Native medical professionals who can serve their home communities, building medical infrastructure, and providing medical services are also vital. Implementing tactics is done through the combined efforts of national governments, international NGOs, the World Health Organization, UNFPA, UNICEF, and others.
Midwifery is one of the most important and common roles women have taken in the fight to decrease maternal and infant mortality. The presence of midwives who are overwhelmingly female during pregnancies demonstrates the power women have to impact maternal health. Women have also been essential in educating other women and the general public about healthcare. Women all over the world help to educate other women about proper healthcare and expectations for delivering. Local Native women are the most important teachers in developing nations. Several international organizations also work to educate communities about maternal and infant health, including UNICEF, WHO, and various religious organizations. Service ambassadors for religious institutions often donate time and energy to educate women in third world countries. Women also contribute by donating funds to organizations and donating new clothes and blankets for infants.
Women and children have experienced the strongest direct effects from this movement because it is aimed at improving the health of women, particularly mothers, and reducing infant mortality, promoting healthy lives for their babies and young children. Indirectly, however, entire communities are affected by this social movement. As access to health care improves, women are able to have safe pregnancies and deliveries, and their babies are able to grow up to be productive members of society.
Globally, the maternal health movement is doing well. Maternal mortality has dropped by 44% since 1990, and under 5 mortality rates have dropped by 49%. However, every day approximately 830 women die from preventable causes related to pregnancy and childbirth. Maternal and infant mortality rates continue to remain high in certain parts of the world. As of 2012 in Somaliland, there are 1,000 to 1,400 maternal deaths per 100,000 live births. Infant mortality is 73 per 1,000 births, and under 5 mortality is 117 per 1,000. In Somalia, generally, only 38 to 44% of births are attended by skilled health professionals. Governments, organizations, and individuals globally are continuing to fight for better maternal and infant health. One prominent example of an individual fighting for maternal and infant health care is Somaliland's Edna Adan.
Edna Adan was born in 1937 to a prominent medical doctor in Somalia, and he became Adan's biggest role model. Following in her father's footsteps, Adan studied nursing and midwifery in London, becoming the first Somali woman to study in Britain. Some also say she was the first qualified nurse and midwife in Somalia. After school, Adan served in the World Health Organization. She married Somalia's prime minister and became involved in government. Her work as Somaliland's Minister of Family Welfare and Social Development as a foreign minister fueled her passion to improve the health care of her country. Her experiences and her father's service inspired her to build the kind of hospital that her father would have wanted to work in.
Adan opened the Edna Adan Hospital in Somaliland's capital in 2002. The hospital provides a wide variety of pediatric, maternal, premature birth, and surgical procedures and serves as a midwifery school. After women have completed extensive training, Adan sends the new midwives back to their communities so that there are trained professionals in all parts of the country. This aims to attack rural communities' lack of access to reliable or formal health care. Adan hopes to dispatch 1,000 midwives throughout rural Somaliland. As of 2014, she has trained over 400.
Perhaps Adan's greatest obstacle is Somalia's ongoing civil war. Since the war's beginning in 1986, the war has destroyed Somaliland's healthcare system. At its start, skilled medical professionals fled the country or were killed. 95% of cities were destroyed, wiping out most medical facilities. The resulting vacuum of medical professionals, medical facilities, and infrastructure that connected women and children to health care led to Somaliland having one of the highest rates of maternal and infant mortality in the world. When Edna Adan opened her hospital in 2002, she was starting from scratch. Another serious challenge is the lack of female, family, and community education in Somaliland about health benefits and the risks related to common household practices. The lack of education creates low demand for preventive, promotive, and curative health services for maternal and child health. Inconsistent healthcare norms and structures across the country are also challenges.
Despite obstacles, Adan's efforts have helped thousands of women and children. She has been added to the Medical Mission Hall of Fame, received an honorary doctoral degree from Clark University in Massachusetts, and also became an honorary fellow at the Cardiff University School of Nursing in Wales. She was featured in the book and later documentary Half the Sky, Turning Oppression into Opportunity for Women Worldwide, which featured women who have turned oppression into opportunity. For her life-saving work, Adan has been called the Muslim Mother Teresa.